Hey, good morning. Hope you're doing all right. It's Dr. Morris from Magnolia Medical Center here in Middle Tennessee. Uh, Wanted to tell you about a recent personal experience, meaning not it wasn't me, but my family. My mother-in-law was, pardon me, recently diagnosed with a very non-invasive, very benign form of breast cancer, and she's going to have a lumpectomy. But I wanted to go over with you. She went to the oncologist yesterday, which I'm not a fan of. We really trying to avoid some of the more invasive treatments, which fortunately they didn't recommend. But I want to tell you what she was told yesterday. She was told by the oncologist that most supplements and homeopathics can increase the risk of cancer, right? And I thought, wow, this is really ridiculous. Like, this doctor actually must not really know anything whatsoever, or not recall anything, because you are taught things in school as part of medical school and whatnot about normal physiology. But to say supplements and homeopathics and things like that are bad for cancer is blatantly false. It's not true. Now, there may be some things that could aggravate cancers. We don't want certain things growing, like things that can impact growth hormones and things like that. Not growth hormones, sorry. Hormones that promote growth, like testosterone and estrogens, in certain types of cancer can be bad for sure. However, she said a blanket statement that says we don't want you taking any supplements. They're no good for your situation. Stop taking them. And what I thought was really interesting is this doctor, number one, doesn't even realize that most of the supplements that are being most of the medications on the market today at least started out from something that occurred in nature. And the reason they were developed is because they showed promise as a natural thing. And if a pharmaceutical company could figure out how to alter it just enough, the way it occurs in nature, they could get a patent on it and sell it as a medication. Aspirin is a good example of that. Ephedra, right? Sudafed. These are most medications start out as something that occurred in nature, and a pharmaceutical company said, "Hey, this is actually really promising if we can figure out how to patent it." So, for a doctor to say that medications are really the only way to go and supplements are bad for you is really a brainwashed viewpoint. They're brainwashed to believe that only a pharmaceutical company could take something and actually turn it into something effective. It's not true. Most medications started out as something that occurred in nature, uh, meaning like I said before, they just got an idea based on, hey, this works, like the willow bark tree. Wow, how about that? Even Hippocrates talked about chewing on bark to help reduce fevers and pains because the willow bark has the things that has the same thing as aspirin, right? So I just thought it was really asinine. I use that word a lot. So, I thought it was really ridiculous that this doctor was saying don't take supplements when the things that she uses started out as a naturally occurring thing that happened in nature, much like a supplement, right? The other thing that bothered me about the oncologist, and unfortunately she didn't recommend, pardon me, fortunately she didn't recommend chemo because we probably would not have done it. But the interesting thing about chemo, most oncologists, most medical oncologists, not the surgical oncologists, but the most medical oncologists make their revenue, most of the revenue comes from the resale of oncology, of chemotherapy drugs. So um, I thought it was ridiculous. You really need to be able to think. You really need, when you're going to the doctor, you have to be able to think, right? You have to be able to go, okay, what's this person telling me? What does that mean? How does that relate to something that you feel confident and know about? How does it relate? How does it not relate? You have to be able to observe what you're being told. You know, you have to be able to really listen, read between the lines, because you could be told things that the doctor doesn't know anything about. You know, as an example, doctors say, I've heard this so many times. I've heard this from Vanderbilt doctors. I've heard this from Mayo doctors. I've heard this all the time. Is they say vitamins don't work. Well, the basic physiology of the body is that is actually such a ridiculous statement. It's the basic physiology of the body. When we say basic physiology of the body, I've got some books on my bookshelf over there. I wish I could reach them at the moment. But physiology books, this is like stuff that you study in order to graduate any type of healthcare uh, school. If you learn physiology, you realize that vitamins are essential to normal function. You need magnesium. There's about 10,000 processes in the body that require magnesium. You need calcium. You need sodium. You need vitamin B, vitamin B12, B6, B9, B12, all these B vitamins. You need vitamin A, vitamin D. So when somebody says something that the doctor says vitamins don't work, they're unnecessary, just understand what they're saying is ridiculous, right? It doesn't even make sense because normal physiology requires vitamins. The term vitamin comes from two different words, vita, which means vital, and amine, which is an amino acid, like so vital amino acids, right? So this is where it started, right? So you had substances that long time ago somebody realized, oh, we have to have these things if we are going to live. If our bodies are going to function, we have to have these things. So they called them vital amines. They're vital. So vitamin. So you have to have these things, right? So anyway, it's a little bit of a rant because my mother-in-law, this is kind of, again, a personal experience, went to the oncologist yesterday and the doctor told her, don't take any of the things you're taking because they can be harmful, which none of them are. We already looked in them up and we determined there's nothing in there that could be harmful to her. And it was just a blanket statement. It was asinine. It was a dumb statement. And it seems as though she completely forgot all of her basic training in her undergrad and medical school regarding normal physiology. And is frankly, in my opinion, probably just bought and paid for by the pharmaceutical companies and totally brainwashed by big pharma. And that's how she functions in her practice. We're happy that she's out there. I'm sure there's people that she's helped with cancer and whatnot, but you really have to be able to pay attention to listen to what people are saying. So I'm Dr. Dave Morris with Magnolia Medical Center here in Middle Tennessee. We are Tennessee's largest non-drug, non-surgical pain clinic, as well as a functional medicine practice where we're looking at getting to the bottom of the problems that people have so that we're not having to treat it with medications and surgeries and things like that. If you like this video, please hit that share button. I appreciate you watching. I see we had a few people on here. I appreciate it. Hit that like. Give me those little likes, those little thumbs up and the little hearts, and hit that share button. I appreciate you watching, and we'll see you next time.